Dextrocardia. When the main cardiac shadow lies to the right of the midline, dextrocardia should be suspected, provided that there is no significant lung lesion pushing or pulling the heart to the right side. In this X-ray, note that the heart shadow on the right is an absolute mirror image of a normal heart. This is dextrocardia. The apex of the heart is on the right side and the aortic knuckle is seen on the right side. Of course, one must be certain that the X-ray is correctly labeled. If the mark R is mistakenly put on the left side of the X-ray plate, a wrong diagnosis of dextrocardia may be made. So if in doubt, a clinical correlation and fluoroscopy should be done to confirm the diagnosis. In this child, there is dextrocardia with the apex on the right side and aortic knuckle on the right side. Now note that the air in the stomach and intestines is located on the right side with the liver shadow on the left. This is situs invertus, where all abdominal organs are also on opposite side. This is another case of situs invertus. Note the dextrocardia with the apex of the heart on the right side, aortic knuckle is on the right, the stomach bubble is on the right with liver shadow on the left. Now observe the lower lung fields. Note the patchy opacities and tiny cystic areas in the medial portion of the lower lobes, suggesting bronchiectasis. Clinically, the patient had copious expectoration. This is Cartagener syndrome, dextrocardia with situs invertus with bronchiectasis. So, in a case of dextrocardia, first check that the X-ray is correctly labeled. Confirm that the aortic knuckle is on the right. If the aorta is on the left, then it is not dextrocardia, but a normal heart pulled to the right by a lung pathology. Then check the stomach air bubble and liver. If they have changed their positions, then it is situs invertus. If situs invertus be present, look for changes of bronchiectasis in the lung fields.
For more such stuff, do subscribe to Date with Medicine.